I'm Dr. Amber Bradshaw. I'm a minimally invasive gynecologist. So endometriosis is a chronic condition where the endometrial lining, which is the lining that a woman bleeds every month, grows into the abdomen instead of in the uterus where it normally would grow. The true incidence of endometriosis is unknown because a lot of women aren't symptomatic from endometriosis and it might never be found. In people with pelvic pain, it can be anywhere from 10% to 35% of women. Genetic component, there hasn't been a specific gene that's been linked to endometriosis, but a lot of women will have a family history of it. So I'm sure one day they'll find the gene that carries it in some families. Everybody's a little bit different, but most likely you'll start to develop it when you start having periods. But normally women will start to have problems in their 20s to 30s. So again, it's a broad gamut. Some women can have no symptoms from their endometriosis. Some women can have pelvic pain, painful periods, painful intercourse. Those are probably the most common. It can affect fertility. In fact, a lot of women that undergo a surgery for infertility will be found to have endometriosis. Women that have endometriosis and have infertility should undergo surgery. Studies have shown that they're more likely to become pregnant after surgical options than with medical options. So I think sometimes people are on their birth control pills for a long time, but if they become pregnant and they're having problems, then a surgical option would be beneficial for them. It is treatable, but it is considered a chronic lifetime condition, meaning that you'll need to undergo some type of treatment probably most of your life. And we try to typically treat you with medications to start off with. Most common kinds are birth control pills. Suppressing your natural hormones or taking away your periods with birth control pills are usually the first line. And then we have other types of medications that can put you into something like menopause for short periods of time. And then there's also surgery. But we like to hold off surgery as long as possible because people may need more than one.